Welcome back. So today we are looking at anemia. So anemia is a well-known blood disorder which we've read about in several discussions and in families and as well as in communities. Anemia has been talked about as a condition that affects a good number of people amongst us in communities and everywhere around. So let's get to know what it is. Anemia is simply a condition of having lower than normal number of blood, okay? Lower than the normal number of red blood cells or quantity of hemoglobin. That is what is referred to as anemia. So anemia diminishes the capacity of blood to carry oxygen, and patients with anemia generally will feel tiredness, fatigue, appear pale, and children with chronic anemia may be prone to infections as well as we will exhibit actually learning problems. Okay, so if we look at these symptoms, which are generally for anemia, which is tiredness, fatigue, and paleness, as well as shortness of breath, including the palpitations, developing of palpitations. All these symptoms have to do with a reduction in the oxygen carrying capacity, which anemia brings with it. So those are the general signs and symptoms of anemia. So this anemia is not one type. There are different types of anemia, and each one of them needs different treatment and also presents in a different manner. But at the end of the day, most of them, if not actually all of them, will present the general signs and symptoms together with a little differences that differentiate each one of them. The most common types of anemia are iron deficiency anemia, aplastic anemia, hemolytic anemia, as well as the pernicious anemia. So these are the most common ones. We also have those ones that are rarely seen, such as thalassemia, as well as Fanconi anemia. Sickle cell anemia is also among the common types of anemia that we see around. So let's get into each one of them. Iron deficiency anemia. The most common form of anemia is iron deficiency anemia, which is usually due to chronic blood loss, most of the time caused by excessive bleeding. Also, it could be due to increased demand for iron, such as what happens during pregnancy, at the time of fetal growth, and children undergoing rapid growth spurts in infancy as well as in adolescence. All these can cause iron deficiency anemia. This condition is treated with iron supplementation as well as the treatment of the underlying cause. So meaning it could be due to some pathology going on somewhere, which could be causing iron deficiency. And if that is the cause, the solution is to start by treating that underlying cause and the presentation will go. But if it is out of a loss or diet, the supplementation part will help so that you have adequate iron and you reverse whatever the presentation will have been as at that point. So most of the common causes of this type of anemia occur due to iron deficiency when the rate or loss of iron is not the rate of loss of iron is not equal to the amount in which it is being absorbed. Okay, the more iron that is lost is not iron is actually when you take it or it is not supposed to be lost at all. It is supposed to be absorbed. So it will result when the rate of loss or use of iron is more than its rate of absorption as well as the use. So the reasons for this, there are a number of these reasons. Some of them could be chronic loss of blood, like what we are going to see, or like what we would see in conditions that have to do with excessive menstruation, in gastritis, in peptic ulcer, as well as in hemorrhoids. Also, it could be to increase the use of iron, such as in pregnancy, which would also cause a deficiency because there is a lot of competition. The child is also competing for the same amount of iron with the mother. So this would cause the development of anemia in the mother, which is iron deficiency anemia, including decreased absorption of iron, which could be due to partial or total removal of the stomach. Also, lack of stomach acid, as well as what would result in chronic diarrhea. Signs and symptoms which would be seen. The most common signs and symptoms of anemia include tiredness, weakness, shortness of breath, and sometimes fast heartbeat. Okay. Amongst them, there could also be inflammation of the tongue, making it look shiny and inflamed, known as glossitis, angular stomatitis, and in some instances, the patient also suffers from what is known as pica, which is a craving for non-nutritive food substances. Treatment for iron deficiency anemia will depend on the cause and severity of the condition, and treatment may include dietary changes as well as supplements, medicines, and surgery. Severe iron deficiency anemia may require treatment in hospital, blood transfusion, iron injections, or intravenous iron therapy. Infants and young children, women, and adults who have internal bleeding are at higher risk of developing iron deficiency anemia. The next type of anemia is aplastic anemia. Aplastic anemia is a blood disorder in which the body's bone marrow doesn't make enough new blood cells, new red blood cells. This may result in a number of health problems, including arrhythmias, enlarged heart, heart failure, infection, as well as bleeding. So in this type of anemia, in this type of anemia known as aplastic anemia, the blood disorder, it is a blood disorder in which the body's bone marrow doesn't make enough new blood cells. So we are well aware that the bone marrow has the stem cells that make these cells. So if it is not making enough, it will give the rise of this condition known as aplastic anemia, which is due to damage to the bone marrow stem cells, and result into this condition. In more than half of the people who have aplastic anemia, the cause of the disorder is unknown, and the number of acquired diseases, conditions, as well as factors can cause this type of anemia, such as exposure to toxins. Okay, those people who do a lot of fumigation, like those the environmental health personnel, and people that are exposed to pesticide, arsenic, benzene, and a lot of other type of toxins can result or can be predisposed to this type of anemia, in which the stem cells will be destroyed and they'll stop producing much, will stop producing the red blood cells as required. Infections such as HIV can also cause this, as well as autoimmune disorders can also cause this kind of disorder. Inherited conditions such as Fanconi anemia, among others, can also result in aplastic anemia. Signs and symptoms of this type of anemia include almost all of the traditional signs and symptoms of anemia, and patients also exhibit some chest pains. They also experience some chest pains. Treatment for aplastic anemia includes blood transfusion and blood marrow stem cell transplant, as well as medication. This treatment can prevent or limit complications, relieve symptoms, and improve quality of life. In some cases, a cure may be possible. Blood and bone marrow stem cell transplants may cure this disorder, as we have heard that it is coming from damage of those stem cells. So the replacement of those stem cells can actually give a cure to these conditions. Also, removing whatever is causing this disorder, like if you notice that it is due to a toxin, that you have been exposed to for long. Once that is removed, the condition is likely to improve, and that may serve as treatment in that regard. People of all ages can get aplastic anemia. However, it is most common in adolescents, young adults, and the elderly are the ones that are likely to be faced with the causative agents that we have earlier talked about. Okay, so the next form of anemia we are talking about is hemolytic anemia. Hemolysis, just talking about the breakdown. So whenever we hear the word lysis, it is talking about breaking down. Now, this time around, we're talking about hemolysis. Hemo meaning blood. So we're talking about the breakdown of blood, the uncontrollable breakdown of blood. So hemolytic anemia is a condition in which red blood cells are destroyed and removed from the bloodstream before their normal lifespan. So red blood cells, when they are made, they have a lifespan of at least 120 days to 130 days in which they are supposed to live. So the body, due to some pathologies, breaks down these blood cells before the time, before their normal time, before their normal lifespan is exhausted, which brings about what is known as hemolytic anemia. It can be due to a number of conditions which can either be acquired or inherited. If it is inherited, one of the conditions that bring about this type of anemia in following inherited conditions are sickle cell anemia, thalassemias, and other types which are itemized here. Amongst the acquired types of these anemias could be autoimmune or hemolytic anemia. So due to autoimmune responses, you find that the person develops hemolytic anemia, and they have this rapid breakdown of cell. Okay, so as we have already explained, the immediate cause of hemolytic anemia is early destruction of red blood cells. If it is inherited, hemolytic anemia, it will be due to disorders of the genes. So the genes that control how red blood cells are made will be 40, therefore different types of 40 genes account for different types of anemia. Hence, this will bring about this abnormal destruction. Okay, the problem with red blood cells may involve the hemoglobin cell membrane or enzymes that maintain healthy red blood cells. In acquired hemolytic anemia, the body makes normal red blood cells. However, some disease conditions or factors destroy this too early. Examples include immune disorders, infection, as well as reaction to medicines or reactions to transfusions. So this, at the end of the day, will lead to early breaking down of the red blood cells, which before their lifespan is exhausted. This will present with the traditional signs and symptoms as we have already itemized, as well as jaundice, okay? Leg ulcers, as well as pain may accompany this condition as part of the signs and symptoms. Treatment for hemolytic anemia include blood transfusions, medicines, plasmapheresis, surgery, blood and marrow stem cell transplants, as well as lifestyle changes. So these are at least some of the things that can be adjusted as we are trying to treat this condition. So lifestyle changes are some of the, lifestyle is also one of those that can be considered when trying to get to treat this condition. Hemolytic anemia can affect people of all ages, races, and sex. Everyone is at risk in this type of anemia. The other type is known as thalassemia. Thalassemia are inherited blood disorders which cause the body to make fewer healthy red blood cells and less hemoglobin, and which is less hemoglobin is also produced. So when there are fewer healthy red blood cells, it will translate in this red blood cell not having a healthy hemoglobin as well. So we know the hemoglobin is the protein that carries oxygen. So meaning the oxygen carrying capacity, just like in any other type of anemia, is also affected. the two major types of thalassemia are alpha and beta thalassemia. So as we are well aware, the structure of the hemoglobin is made up of two chains, which is the beta chain and the alpha chain. So whichever chain is affected here is what is referred to as either beta or alpha thalassemia. So the most severe form of alpha thalassemia is known as the hydrops fetalis, and the most severe form of beta thalassemia is known as Cooley's anemia. So these are the two types of anemia that will be as a result of the chain that is affected. And this is genetically controlled because these are cells and they are genetically controlled in the way that they are made. So if there is a defect in the alpha chain, in the alpha chain, when making these cells, therefore this person is likely to develop the alpha thalassemia. And if it happens in the beta chain, the same happens. So people who get abnormal hemoglobin genes from one parent, but normal from the other parent, remain carriers. So you find that if you are passing, there is 50-50 contribution in these cells during reproduction and in genetics when we are passing on the genes uh, from uh, from the mother cell to the daughter cell. So if one person has a recessive gene paired or married to a person who has all dominant genes, like they don't have any gene that has this type of anemia, meaning the child will have a recessive gene as well. So meaning that recessive gene is going to be passed on to the child, and the child will have a recessive gene. And since they have a recessive gene, they may just experience mild anemia and nothing much because they will be carriers. But if that child with a recessive gene marries somebody who also has a recessive gene from the other side of the same abnormality, that child they are going to have is going to have a dominant gene of this anemia, and that now is now going to be a patient. Since the parents are carriers, they have just been carrying that gene. And their offspring is going to have a dominant gene, and they are going to be patients of this kind of anemia. Therefore, symptoms of thalassemia are caused by lack of oxygen in the bloodstream, okay, which arises from the body's failure to make enough healthy red blood cells as well as the hemoglobin. Okay, so amongst the symptoms again, we have the traditional ones combined with jaundice and large spleen as well as the bone problems. Treatment of thalassemias depends on the type and severity of the disorder, and people who are carriers or who have alpha or beta thalassemia need little or no treatment, okay? Because it is genetic. Therefore, three standard treatments are used to treat moderate and severe forms of thalassemia. These include blood transfusion, iron chelaton therapy, as well as folic acid supplements. People who have a family history of this condition are at higher risk of developing it. We have already explained how it is moving from one group to the other. The other type is known as sickle cell anemia, which is one of the common forms of anemia which we actually have or seen or heard about in our communities. Sickle cell anemia is a serious disease in which the body makes sickle cell shaped red blood cells. Normal red blood cells are supposed to be disc-shaped and move easily through the blood vessels. In sickle cell, the body will produce the sickle cells will contain abnormal hemoglobin that causes the cells to have a sickle shape, okay, which don't move easily through the blood vessels, and they are stiff as well as sticky and tend to form clamps and get stuck in the blood vessels as the blood is trying to navigate through smaller blood vessels, capillaries, as well as in arteries. Therefore, these clamps of cells, okay, this clamp of sickle cells block blood flow in the blood vessels that lead to limbs and organs. And these blocked blood vessels can cause pain, serious infection, as well as organ damage. In sickle cell anemia, a lower than normal number of red blood cells occurs because sickle cells do not last very long. Okay, they usually die after 10 to 20 days, and the body cannot reproduce red blood cells that fast to replace the dying ones, which causes these problems. Okay, because we have already stated that the lifespan for the normal red blood cells is somewhere around 120 days to 130 days. People who have this disease inherit two copies of this type of anemia, so it is inherited, and we have already explained how the inherited conditions would come about. If they have a recessive gene, they will be carriers, but once they get two copies of recessive genes from their parents, the offspring is going to have a dominant gene, and they are going to be sickle cell. They are going to be sickle cell patients. Okay. It presents with the same signs and symptoms. Okay. In that, the only striking thing here is that it produces sudden pain throughout the body, okay, which is also one of the common symptoms of sickle cell anemia. This pain is called sickle cell crisis and often affects the bone lines as well as the abdomen and the joints. Sickle cell anemia has no widely available cure. The goals of treating sickle cell anemia are to relieve pain, prevent infections, eye damage, strokes, as well as control other complications. The risk factors are from families that are carriers and those that have descended from certain regions of the world, including from Africa, South and Central America, the Caribbean islands, amongst others. Pernicious anemia is a condition also, which we are talking about. It is a condition in which the body can't make enough healthy red blood cells because it doesn't have enough vitamin B12, which is a nutrient found in food. People who have pernicious anemia can't absorb enough vitamin B12 due to lack of intrinsic factor, which is a protein made in the stomach. So the production of this intrinsic factor will allow us to absorb vitamin B12, which is usually carried in diet. Lack of intrinsic factor is a common cause of pernicious anemia and the body's inability to absorb vitamin B12. Therefore, some pernicious anemia occurs because the body's small intestine can't properly absorb vitamin B12 due to the wrong bacteria, the wrong bacteria that are found in the stomach. Sometimes people develop pernicious anemia because they don't get enough vitamin B12 in their diet. So it is important to get this, to eat balanced diets. So it is either vitamin B12 you are eating enough, you are having enough in the diet, but the body is not able to absorb it, or you are actually not having enough vitamin B12 in the diet. So that if that happens, one of the two happens, is that what will get to developing pernicious anemia. Apart from the traditional signs and symptoms, the vitamin B12 deficiency may also have serious symptoms such as damage to the nerve. We have had people who have this type of anemia also complain of numbness. Okay, they complain of numbness, then they give them vitamin B12 among other vitamins. In the B class, and here we've heard of vitamin B12, B6, and others known as B complex. So those ones, they help nourish the nerves. And if that goes on, it can cause this type of anemia, which will also cause, among others, nerve damage, neurological problems, enlarged liver, among other conditions. Infants who have vitamin B12 deficiency may have poor reflex or unusual movements such as face tremors. All these have to do with neurological abnormalities. Treatment of pernicious anemia is done by replacing the missing vitamin B12, okay? Which, if identified where it is coming from, is it in diet? If it is in diet, improve the diet with this type of vitamin. And if it is due to lack of intrinsic factor, also treat the underlying cause and reverse the condition so that there is improved uptake of vitamin B12. Amongst the people that are at risk are those that have family history of this condition, those that have other conditions such as autoimmune disorders, type 1 diabetes, Graves' disease. These are among the common conditions, including the vegans, strict vegans, okay, strict vegetarians who don't eat any animal products or dairy products and don't take vitamin B12 supplements, okay. At the end of the day, these are also at risk of developing this type of anemia. The other type is known as Fanconi anemia, okay, which is a rare inherited disorder that leads to bone marrow failure. Okay, Fanconi anemia is a type of aplastic anemia that prevents the bone marrow from making enough new red blood cells, okay, for the body to work normally. So this anemia can also cause the marrow to make many abnormal cells, and that will continue like that. It continues in, it proceeds it complicates rather into serious health problems such as leukemia, okay? To complicate in serious conditions such as leukemia. Children who inherit Fanconi anemia are at higher risk of being born with birth defects. And people who have this type of anemia have a higher risk of developing cancers. It is very unpredictable disease, and the average lifespan for people with Fanconi anemia is somewhere around 20 to 30 years. The most common cause of death related to Fanconi anemia are bone marrow failure, leukemia, as well as solid tumors. Causes, it is inherited, okay, and it is been traced to be coming from at least 13, 40 genes associated with this type of anemia. It develops when parents who pass the same 40 gene to their child, which we have already explained the mechanism, the child will be from two carrier parents, causing the child to develop this type of anemia. People who have only one will be carriers, and it has already been, as it has already been explained, how this comes about from two carrier parents. Therefore, signs and symptoms of Fanconi anemia include the general symptoms of anemia, which we have already explained: bone marrow failure, birth defects, as well as developmental and eating problems. Treatment for this type of anemia is based on the person's age and how well or poorly the person's bone marrow makes new cells. The four main types of treatment for this type of anemia are bone and blood and marrow stem cell transplant, androgen therapy, synthetic growth factors, as well as gene therapy. Fanconi anemia occurs in all races, ethnic groups, as well as it affects men and women equally. You are at an increased risk of developing the disease if you have a family history of Fanconi anemia. Okay, so this is the end of our presentation. Thank you so much for your attention.